Good afternoon to you all. Good afternoon. This video is going to be very short, but it's to the point. The lady you see in the video, she's been given a week to live. A week, literally. She's our mom, our Yoruba woman, Mrs. Adesonya, I believe. Her daughter is Adesonya. Her daughter has brought this to us. She has a week to live. Her heartbeat is so low. It's about 35 beats, and you need to be something like 70 or something to be okay. She's below that. She needs a pacemaker. I think it's going to cost between about 2.5 million to 3 million naira. That's what she needs. We need your help. Her bank account is there. Don't send any money to Citizen AY. Don't send it to my bank account. Her details are on the screen. As I'm talking to you, you can see it. Let us watch this together. When you get this broadcast, I want you to share it. I want you to share it. It's very, very important. When you get this broadcast, I want you to share it. It's very important to help, whatever we can. One of the things I'd like to say is these are the kind of things that we expect that Contraction Nigeria will give you. Yet Contraction Nigeria will ask you to be one Nigeria, but Contraction Nigeria is not giving you healthcare. We are now having to source the money to try and speak to people, get people to donate. Contraction Nigeria should be the ones providing this. This is the normal procedure that would happen, a pacemaker. But we haven't got the money for it. They can do it there. This is something that should be free. But they have to, this is something that should be free, especially for our elderly people. This is, where's the healthcare? Please, we are calling on you. I'm going to share this video. I don't want to take too long about it. As you know, I'm blocked on Facebook. Please do share when you get this podcast. Please, I urge you. Let's watch, and I'll show, a few minutes, then I'll wrap it up. Here we go.
Grandma, ẹ pẹ̀lẹ́ mà. Ẹ bá àwọn tó fẹ́ ràn yín lọ́wọ́ sọ̀rọ̀.
You see, she's so weak. Her eyes are sunken in.
Video fún. Wọ́n ní ká send video yín pé kán lè fi wá ìrànlọ́wọ́ fún yín lórí nǹkan tẹ́ fẹ́ ṣe.
She needs our help. They're telling her to speak up. I'm translating because you're watching in, you'll be watching on Citizen AY. She is nervous. She's, she can't speak up. She needs our help. She's asking for help. Please, whatever you can do to donate, please. Whatever you can do to donate. I'd ask you to share this broadcast, please. Share it. And I will go live on it I'll go live with 2 videos later on. But this is one of them. I want you to share this, please. She's asking, she's begging us she's begging, please God, she's saying, for God's sake, please help me, please. She has, she can literally die within a week.
Ẹ mọ̀ pé ìgbà tí mo délé ní àná, mo ṣàlàyé fún yín pé ọ̀rẹ́ mi tó wà l'Amẹ́ríkà, òun ni mo pè tí mo fi bá sọ. Tí tó fi dí ká ṣe ilé ẹ jọ̀ọ́ ẹ̀yin èèyàn, ẹni tó ń bá yín sọ̀rọ̀ ìyá mi ni wọ́n orúkọ tèmi ni Olúṣọlá Adésànyà. Ìyá mi ni ẹni tó ń bá yín sọ̀rọ̀.
The person who is speaking now, that's her mom. Her mom is the one watching who spoke in Yoruba. The person speaking, Olúṣọlá Adésànyà, that's her bank account that you see on the screen. Donate to her account. She needs about 2.5 million naira. Her mom can literally die within the next week. And this pacemaker is not something that's difficult. It's something that could be done. They can do it, but they need funding. Please do what you can. Here we go.
So, ìrànlọ́wọ́ la béèrè lọ́wọ́ yín. Nǹkan tó dẹ̀ ṣe wọ́n náà ni pé wọ́n ní bradycardia. Ńṣe ni.
Now they have something called bradycardia. Our mom here, she has something called bradycardia, and that's affecting her heartbeat and everything else. Here we go.
Pulse wọn ó máa ń lò ìgbà míì ó ń gbé 30 èyí tó pọ̀ jù tó gbé láti bí ọ̀sẹ̀ kan sígbà tá a wà yìí is 35, I mean sorry 45. òun ló pọ̀ jù tó gbé láti bí ọ̀sẹ̀ kan sígbà tá a wà yìí. So ní 2019
She's been having this since 2019. She's been having this since 2019. And if we had a good healthcare system, this could be taken care of. For her age, this is something that will be, this is why we cannot support one Nigeria. We have to go for Yoruba Nation. For our women, our mom like this, she should be, this is something that the state should provide. And we know that when we get Yoruba Nation, the state will provide it. Because we will mandate that our healthcare is free for all. Just like late Obafemi Awolowo did in the Western region. We'll do the same thing. Please, whatever you can do in the short term. But these are why we're going for Yoruba Nation. Listen up.
Fa láti 2015 gan láti mọ̀. A dẹ̀ ti ṣe wọn.
2015. In fact, it goes further back. I mean, where's the healthcare in that contraption? That's why we're going for Yoruba Nation.
Ba ìta lè ṣe lórí ẹ̀ tẹ́lẹ̀ náà. Ṣùgbọ́n ìgbà tó dẹ̀ tún rí báyìí náà, kò sí nǹkan téèyàn lè ṣe ju pé kéèyàn wá ìrànlọ́wọ́. So wọ́n náà fẹ́ ṣe heart surgery fún wọn, minor heart surgery. It's not a major surgery. It is called pacemaker surgery. Ìyẹn ló máa ràn.
So she needs a minor surgery called a pacemaker surgery. Now let's go and see what that looks like. I don't know if I'm going to try and see if I can get some update on that for you. Let's do this. So in fact, I'll do that whilst you're here. Pacemaker surgery. This is what they will do in pacemaker surgery. Okay. I just want to show you what it looks like. Surgery. So pacemaker surgery video. I just wanted to just see. Let me just check before I show it because it might be gory. Let me just check. I want to just check. Let me see if it will work. It may work. It may not work. No, it's not going to work. I just wanted to just check. Let me see. It may not work, but there are videos. So let me just go and check something quickly. If I may show it, I may not, because I do not want to, one has to be careful. So let's go here. So let's go here. Let's go here. Sorry, that's not what I'm trying to do. Okay, so now, so let's do this. Okay. Okay, let's do this. So we're gonna try and do that. So now I want to show you what it looks like. Let me see if it works.
So this is a
now. Getting a pacemaker, watch an implant procedure. Let's talk through this. This may help. This is what they will do if they were going to do it back home. It's going to cost 2 million. This is what it looks like. So let's do this. So let's just watch here.
Pacemaker implant. We begin with a sterile prep of the skin. We surround that sterile preparation with these sterile blue towels. So we're trying to create a very sterile working environment. Then the patient gets covered with this total body sterile drape, like you see here being unfolded. And this is all to minimize infection. The sterile IO-band patch then goes directly over the skin and we'll be working through the IO-band patch. So here's our setup. So I come into the case, I do a sterile hand scrub, I'll get a sterile gown, double glove, minimize the chance of infection. Here we go with the double gloves.
And time is going.
And we are ready to work. So we approach our table. The first thing we'll do is a venogram. So we're going to image the vein through which we're going to implant the pacing leads. So there is the vein, the large vein flowing down into the heart. And we'll use the location of that and the edge of the ribs to actually plan our incision so the pacemaker sits over the edge of the rib. So here we're actually identifying it under the x-ray and using black markers to show us exactly exactly where our skin incision should be. We numb it up with lidocaine so the patient is anesthetized, won't feel anything as we make our insertion. That's the lidocaine going into the skin. Just under the superficial layer, we apply generous amounts so there's no chance of the patient having any discomfort at all. And there we are making our incision as planned so that the final pacemaker will sit over the rib margin, which that other straight line identified. Then we extend the incision down to the muscle. This is with electrocautery, as you see here. Then from the base of that insertion site through the muscle, we use a needle to gain access to that large vein which we imaged. And there you see our needle coming in from the right. We're over the first rib. We get a little flash of blood black that lets us know we're in the vein. This is kind of a delicate step. The syringe comes off, and then through that needle, we're going to pass a guide wire through the insertion needle, through the vein, down into the heart, and this is the track over which we'll implant the leads. Now it's exchanging that needle for a series of sheaths. Here's the first sheath. This is with a micropuncture kit, so the first sheath is kind of small. We remove the guide wire, and then through that first small sheath, we implant the larger guide wire, which will support the sheath that we'll use to implant the pacing leads. So there you see that larger guide wire going in through the veins, in down to the heart. Out comes the outer sheath. So first of all, we'll get the second access site for the second insertion. This is the second access site for the second lead down to the bottom chamber of the heart. There's our needle accessing the vein, passing the guide wires exactly as before as we get that second insertion site. And here is the outer sheath, the larger sheath through which we'll implant the pacing lead. So that goes over the guide wire into the vein, and you can see us advancing that here into the vein to guide our lead. There it is on the x-ray image, advancing into the vein. And now through that sheath, we're advancing that pacing lead. Also looks like a wire down into the heart where we will position that. And here we're shaping the inner stylet that goes through the lead body. This is going to lift the tip of the lead into the final position. We're trying to pace the heart from the top of the heart, if you will, from the conduction system. We call it the His bundle. We want to engage the normal conduction system directly so that the pacing of the heart is entirely physiologic through the normal conduction system. So there we're advancing that stylet through the lead. This lifts the lead tip, as you see, and we're using that to be slowly withdrawn to engage the conduction system. And the bottom blue line is us recording from the heart. We see that the conduction system signals are there. Pacing confirms that we can pace satisfactorily from that location. And having confirmed the good lead characteristics, we extend the set screw at the tip of the lead, securing it into the heart muscle. That inner stylet is there, then carefully withdrawn as we put just the right amount of slack on the pacing lead. There's our device reps helping us with the lead characteristics as we work through the case. And there again, those beautiful conduction signals that we had from the start of the procedure. Our nurse attends to the patient, takes care of all of that person's needs, make sure they're completely comfortable. There we are removing that outer sheath. It's a breakable sheath that we then peel away to take it off of the lead. We'll remove that entirely from the body. We anchor the lead to the muscle, directly to the chest muscle, secure it firmly so it cannot move and matures exactly in that spot. So there we are anchoring the lead to the muscle with a non-resorbable suture. There's our pacing lead, beautifully moving with the motion of the heart at the top of the heart, engaging the conduction system directly. And there we insert the same sheath like before to advance the lead for the top chamber. And there you see the second lead now in position in the top chamber of the heart. We record the electrical signals from the top chamber. Beautiful, nice current of injury, which is what we look for, the width of that blue signal. We can pace satisfactorily from that site, and like before, we extend the set screw into the muscle with that twisting motion. The stylet will then be withdrawn. We add adequate slack to the lead, remove that outer breakable peel away sheath just like before, take it away from the body, and like the bottom lead, we attach the top lead firmly to the chest muscle so it cannot move and will mature perfectly in that site. So this is what we're doing here. It's a little bit tedious, but we take it very seriously so that lead system is very secure and stable for the patient.
I hope you're watching this. Whatever you can do.
Here we are opening the pacemaker. It's a sterile device. Take off the outer cover. There's the pacemaker unit. That's the battery and the computer. The leads are going to plug directly into that header. We flush out the tissue pocket that we created with a sterile flush. Make sure everything's nice and clean, good hemostasis, no additional bleeding. There we're implanting the leads into the header of the pacemaker. We use a set screw again to secure those leads into the header of the pacemaker so they can't come out. Make sure they're secure. This particular patient wanted us to go under the muscle with the pacemaker. We call that a submuscular pocket. So after numbing it up, we create a tissue plane under the muscle fibers so the pacemaker can sit actually below the top layer of the chest muscle. And there we are creating that extra pocket. The pacemaker is now inside, and we are closing those chest muscle layers over top of the pacemaker so it is completely underneath the muscle. Following this, we'll close the skin. We typically use 3 layers to close the skin. A nice secure pocket, great cosmetic result, excellent structural integrity, minimizes the chance of infection, and there we are doing the final skin layer to make that a very nice incision, and that will determine the final cosmetic result and the minimum scarring. So here we are placing steri strips over the incision site that we have sutured shut. These are the final bandages. We'll ask the patient to keep those dry for the next 7 to 10 days till we see them in the device clinic, and we will be the ones to peel off those strip bandages. They add as much structural integrity as the final layer of suture. And there is the final result through the IO-band. We peel all of the dressings away, put the final dressing over top of our steri strips, and this patient will be ready to leave the procedure suite. Typically, we'll keep them 1 night overnight, device interrogation in the morning, chest x-ray in the morning, then home the same day. And there's the final position of our lead system, moving beautifully with the motion of the heart, top and bottom chambers, his bundle pacing, beautiful pacemaker sitting over the lateral rib margin. Will be comfortable for the patient. He will not even know that it is there.
So, ladies and gentlemen, that is what we need. That is what we need. I wanted you to see that, and this is the patient. Once again, our mom here needs your help. The account number there, if you can, whatever you can do to help, please do. Ladies and gentlemen, you're watching Citizen Air, the platform where we speak truth to power. Whatever you can do to help. Ordinarily, this is what the Nigerian government would do. They should be the ones providing this healthcare. But we are having to go and look for good Samaritans, people to help, to keep her alive within a week. Please, we need your help. It is very, very important. Whatever you can do. If you have people and friends who can do this, when you get this broadcast, I cannot share it on Facebook because I'm blocked. If you get this broadcast, share it far and wide. Our mom here, she needs our help. Whatever we can do to donate to help, please let's do. The account number is there. Don't send it to Citizen AY. It's nothing to do with us. It's to do with saving our mom in the picture. And this is a cry for help. The Nigerian government, this Nigerian system of governance has failed us. They don't provide healthcare for us. It's up to us. That's why we're going for Yoruba Nation. Please, let's help our mom here. I pray that she gets the help because they're giving her a week to live. Please help urgently. You're watching Citizen AY, the platform where we speak truth to power. We only deal in one currency, truth. We're the Sorosuke generation. Please, 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 I urge you, whatever you can do, donate to the account number there. Let me read the account number to you. 00500969008. Adesonya Olushola GTB. Send whatever you can do to that. That'll be very much appreciated. I'll stop here, and again, I might talk about it on a live broadcast. But I want you to please, when you get this broadcast, please share, and share. Very, very important. Time is short. She's got a week to live. Her heart muscles are not very working well at all, and the pacemaker will help her. You saw the procedure. That's what will help her. We need 2.5 million naira. Please, please, please help. Thank you so much. Bye-bye.